Services Committee to order, please. And the first thing they need to do is get an approval of last month's minutes. So moved. Mr. Montesi, second by Mr. McDonald. Any corrections, additions? All right, all those in favor? Aye. Opposed? Carried. Okay, Denise, we're all set.
Okay. First on the agenda, requesting a transfer of funds to purchase a standing desk for the reception area. I've had multiple requests by that position, office specialist, over the last year. She did do a statement of what she's currently doing because she does exhibit some health concerns, sitting too long or whatever, so she did write her own statement to support why a standing desk would be beneficial to her position. And lastly, we had to make a change with the grave markers. So we have now gone to aluminum, powder-coated, bronze color aluminum markers, which has contributed to a substantial cost savings to the department. So a geo listing is in this report showing the cost savings going from $2,175 to $801.46. So I'm looking for this year to use some of those funds to purchase a standing desk.
All right, second by Mr. McDonald. Any questions, comments? All those in favor? Aye. Opposed? Carried.
Second on the list, I have just brought to the attention of the Commissioner of Social Services. This is just to open a discussion. The Department of Social Services and the Veteran Services interchange quite frequently back and forth with administrative benefits to a veteran or surviving spouse. We have difficulty sharing information back and forth. We have since I started here, and I'm looking to figure out a way to streamline the process of sharing that information for the sole fact of the cost savings to our local government of getting them off state benefit and onto federal benefits. Here I've attached, they call it a cooperative agreement. It's from Delaware County. They've been doing it for years. There are other counties within New York State that also have agreements between the two departments to share only the pertinent information that's needed to assess what's the best benefit for these particular group of people, the veteran, the surviving spouse of a veteran. There has been some concern as to, the security of this whole thing with PII and PHI, personal health information. I have certificates above certificates of yearly. I do online classes with the VA, so I have federal security clearance in order to administer benefits to veterans within our county. So with that said, and I know the Commissioner's point of view of what she needs in order to do this, but sometimes it isn't possible for the action that's needed. Example would be a veteran in a skilled nursing facility has no relatives and has dementia. I can't really get him to sign off on anything because he's not coherent enough to know what he's signing off to, even if it's with an X, you know what I mean, or a thumbprint or whatever. So again, this is just an example. It's not something necessarily, there are pieces in here that are pertinent to our discussion, but under Delaware's structure, DSS actually carries veterans within their budget, where we do not. So there's a lot of discussion about the budget and blah, 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 but here we're just talking about the actual sharing of information. So like I said, I mean, we have to start the conversation, figure out what we can do in order to streamline the process, because it does make sense to me that if we can get them off state benefit and get them on federal benefit as a cost savings locally, why aren't we doing it?
I agree.
Easily.
I agree. Ron?
Have you talked to the Director of Social Services?
Yes.
And
We have had conversations, but she's caught too, you know what I mean? Per her regulations and laws, there's like this fine line of, you know, what can be released and what can't, and under what circumstances, and without a consensual release, certain things are not able to, let's say, able to be shared, but somehow, within other counties, in New York State, they're doing it, and they're doing it well.
now, what's a consensual release? What does that mean?
I'm sorry, put you on the spot, but can you answer that?
That's where the party signs their own release to say that I'm willing to give my information to the other party. So if a veteran came in and we asked to sign a release so we could talk to veterans, that would be fine. The thing is, when you give out information without having that release, you can get into problems, because if somebody releases something that they're not supposed to, I mean, that's against the law. And if we're talking about health things, that's also highly protected. So I certainly want to sit with Denise and talk with her, and I would like our attorney to sit with us also, so that we can go over and do what is best for everybody, because we don't want to be violating somebody's privacy rights. I'm certainly willing to work on this, but I think I need our attorney to sit with us, or maybe Brian. So,
It would appear that getting the consent is probably one of the first steps.
that's the best thing to do, and then we have no trouble giving information at all. So if what Denise is talking about, an instance there that somebody can't get consent, so we just need to do some research, probably some work with the state about that, and with our attorneys, and see what we can do. I mean, certainly don't want to hold up anybody getting any benefit they're entitled to because of that.
Question, Mr. Light.
Thank you, Mr. Chairman. So Denise, what you're proposing will be a cost savings to the county overall?
Yes,
And-
that, I mean,
And how does that work? Where's the cost shift?
okay, the cost shift would be right down to, and I don't think we've ever really touched base on this. How about, I'm not sure what the annual cost is for a veteran receiving Medicaid medical, coverage, compared to then transitioning them to VA medical. Where's the, I mean, I don't know what it costs for a person, even if it was a baseline figure of, maybe they never used it throughout the whole year, but we have them on there, there's got to be some kind of premium or cost to even having someone on Medicaid, even if it's just administratively, the cost there. But if we can transition from, you know, state Medicaid to VA medical, I'm sure there's a huge cost saving. I'm unsure, Commissioner, is there a check if somebody's a veteran that they're being referred? Okay,
Yes.
I think we took care of that
Yes.
a couple years ago,
Yes,
right?
we did.
Okay, so anyone who comes into social services for any kind of services should be referred to my department to see where we can cover them on a federal level before they even attempt to fill out an application for any kind of services that, you know? That, I mean, it is a small portion, like that 1% of the whole United States are active military or veterans or whatever, supposedly, but it's still there. I mean, we have 7,000 veterans within Warren County. I'm sure at some point in time they walk through the doors for services.
Some do, yes.
Yes, downstairs. And even their surviving spouses, you know, underlying benefits that they aren't even aware that they're entitled to. They've been going for years, have no idea that they're entitled to benefits. If they're the surviving spouse of a veteran, we should be referring them upstairs. Yeah.
All right, so I guess we're going to leave it then that you and Maureen will get together with your attorney, and if you need Brian's help, you'll ask him to sit in. And what are you looking at trying to come up with something like,
Well, I would think that we'd probably want one, something like that. Maybe we don't need to, I don't know. Like I said, I only skimmed through it for the parts that I thought were pertinent.
Right.
But a lot of it is, like I said, information regarding budget from veterans to DSS and doesn't apply to us. But maybe we don't need anything. I think that, again, that's an attorney
you can decide that?
decision.
Maybe
Okay.
just the signing off it might be enough.
Right, and it might be. Sometimes it's not as easy as it sounds to get that, but yes.
All right, any other questions? So we're going to leave it then. You'll be getting together. When you come up with something, you'll come back to the committee to let us
Absolutely.
know what's happening. Okay, sounds good, great.
Thank you.
Thank you.
Thank you.
Yes.
Just one other question. If someone transfers to the federal VA, is there a loss of benefits? Is there a reason why they wouldn't?
It shouldn't be a choice. Social Security right now, administration, if somebody goes in and is filing for SSD, they mandate that they file a VA claim. Even though I know they're going to be denied, they need that denial letter from Big VA saying that they've been denied before they'll administer benefits through Social Security.
Well, I guess the point I'm making, we're going to ask someone to, give their consent so we could look at their records to see if they would go to the feds.
Mm-hmm.
And if they do go, do they lose any benefits from the state program?
I don't know the inner workings of social services. The only thing that I possibly could see is maybe like a rider, like dental care. I don't know if full dental is offered to every individual who applies for Medicaid.
I don't think so.
Okay, so it's the same on the VA side, unless you are completely below the census poverty level, you would get VA dental, or if you're 100% service connected, you would get VA dental at 100%, but if you fall into that you're over kind of thing, unless you're service connected for an injury to your mouth, or the military did work on your teeth while you were still active in service, then dental would probably not be covered.
Where I'm going with this is that if you're going to try and sell someone to transfer to the feds, we need to be fair to that person and say, here's what you might lose, or maybe you don't lose anything, you gain, but that's important too.
Right, they would have medical, if they're eligible for VA medical coverage, they're eligible for VA medical coverage. Okay, and that means that's everything. The only thing that would probably not meet the criteria would be like a rider of dental would be, but they can if they're eligible for VA medical, they can purchase VA dental.
Is VA medical better than New York State's?
Ooh, obviously, me as a veteran, absolutely. But
Well,
I don't know if there's like a strict comparison over, because you're going to private providers with Medicaid compared to going to, it may be a little bit more of an inconvenience, let's say, because we have a VA primary clinic in Glens Falls, and then all specialty care is in Albany. That's not the case under Medicaid. Their PCPs and their specialty care is within your community. So it's a little bit more accessible, I guess. That would be the downfall. But we provide transportation to the VA hospital. So we're kind of filling that gap, for the veteran.
Well, it's not only mechanically figuring it out, it's a selling job too, you gotta do it.
Like I said, even SSA doesn't allow for, well, do I want to apply for VA benefits or I don't? They mandate it. It is mandated. Before they receive any services through SSA, they have to apply for for any VA benefits they're entitled to.
Okay? Are we good? All right, thank you very much.
You're welcome.
Denise.
Not sure what we did.
Well, we'll figure it out as we go along.
Thank you.
Thank you. Thank you.
Morning.
Good morning. We're all set.
First item on the agenda is permission to amend Resolution 153 of 2007 to include a contract with Interim Healthcare in the amount of $40,000 for ISEP services. The monies are in the budget, and it would help both Warren and Hamilton County populations.
All right, someone like to make a motion to approve that? Supervisor McDonald, seconded by Supervisor Bramer. Any discussion? All those in favor? Aye. Opposed? Carried.
Item number 2, it goes along with the request that we had at the last committee meeting to combine our budget codes into just 2, one for Hamilton and one for Warren County. We also need to amend all of our contracts to reflect that. So I figured instead of doing it at each individual contract renewal, I would just do it all at once, so I didn't forget any.
All right, motion made by Supervisor Montesi, seconded by Supervisor McDonald. Any discussion? All right, all those in favor? Aye. Opposed? Carried.
Item number 3 is permission to amend Resolution 509 of 2016, our contract with KLC Property Management for snow removal at the Bolton Meal Site. Occasionally, when there's a heavy snowstorm or a lot of snow accumulation, we do have to have a bucket loader come in to remove the snow. This has not been in the previous contract, so we'd like to add it into the contract now. They said it depends on the amount of snow they have to remove, but it would not exceed $600 per occurrence.
Someone like to bring that motion to the floor? Supervisor McDevitt, seconded by Supervisor Bramer. Discussion. Supervisor Leggett.
Thank you, Chairman. Did you have to do it last year?
Yes, they had to do it once, that's why it came to our attention. We had, I think there was one snowstorm that was pretty big, and then we had a couple other ones before that that accumulated a large amount, so they had to remove it from the actual site. And these monies are actually reimbursed by the town of Bolton.
All right, I was wondering about that. All right, all those in favor? Aye. Opposed? Carried.
We like spending Bolton's money.
Yes. Ron's not here to hear that.
And item number 4 is to enter into an agreement with Hamilton County, pending the approval of the county attorney's office, to provide heat outreach and certification for residents of Hamilton County. This is not a cost that we incur, it's something that they reimburse us if we do it.
All right. Someone like to bring that motion to the floor? Supervisor Montesi, seconded by Supervisor McDonald. Any questions? Claudia?
Thanks. How does this interact with the Warren, Washington, Hamilton County, our community action agency?
I know that Community Action, they do some themselves, but we do a lot of heat applications within the Office for the Aging. I don't know if there really is an interaction.
Okay.
No, it's basically just a way so that we can better provide to the communities of Warren and Hamilton County. We get a lot of DSS individuals that are 60 or older that come to us, and we help them with the applications. We don't get any reimbursement for it, it's just a service that we provide, and it's beneficial.
All right. Any other questions? All right, all those in favor? Aye. Opposed? Carried.
And the last item I have is just our invitation to our annual senior picnic. It is going to be Wednesday, September 13th at the Fish Hatchery in Warren County. You can purchase the tickets at our office if you'd like to attend. They're $5. We are going to have entertainment this year and door prizes as well.
Oh, sounds good. Great. All right, mark that on the calendar, so if any of you are interested in going, I'm sure you'll enjoy yourselves. Is that it, or you have something else? You have something else on your...
Nope, that's it.
That's it? Any questions? Yes, Mr. Simpson?
Yeah, I know Ron's not here, but I ever checked with the county?
Yes. I sent an email to Ron because I thought it was a lot that we were spending on the snow removal, and he said that he wanted to keep it the way it was.
Okay.
I know.
That is a lot.
Because I inquired if they wanted to do the removal, we reimbursed them. I didn't realize at the time that they actually reimbursed us.
That's what I thought, each time.
Yeah, I did think that.
I mean, yeah,
I know, I can do it if you want me to. Just give me a pause.
right?
all right, any other discussion? Okay, thank you very much. I just assumed this was I wasn't sure.
1:30.
She says she can run a mile.
Yeah. Should we just...
All right. Gotta get done, Let's get Richard.
Thank you, ma'am. How are you today?
Pretty good.
Good.
Thank you.
Can I get one?
Oh, wait a minute. You're here.
Oh, thank you.
Here, Julie.
How many bathrooms do you think our showers should be putting
I
in?
thought there was only one. Yep.
That's too much.
When I saw that, I just thought I'd seen a large amount.
Trying to put some programs on the day today.
Aren't you?
Can't just have one.
I already. And I'm Are you going to council tonight?
Yeah.
I won't be there. I have a see that done every day.
Oh, no.
County center. Yeah. No, I didn't even see now.
We're all set whenever you are, Maureen.
All right.
Involved with the charity. So it's like
We'll
starting
start with our,
so we meet on every
request resolution,
first Tuesday.
request to renew the agreement with the town of Queensbury to provide youth programs including but not limited to the Warren County Youth Support activities in the amount of $1,715 for 2017. These services are provided for youth annually.
All right, someone like to make that motion? Supervisor Montesi, seconded by Supervisor Bramer. Any discussion? All right, all those in favor? Aye. Opposed? Carried.
Our second request is to set the salary of the part-time community service worker at $15 per hour. This position is paid for from monies donated by the Warren County Children's Committee.
That was the $20,000, Maureen, that was donated? Okay. All right, would someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Bramer. Any discussion? Ms. Bramer.
Thank you. What is this person doing?
That person will be working with our foster care parents and helping with visitation, making sure they get a good follow-through and just spend time on parenting issues that come up during visitation. And so we hope that provides a better benefit so that we can get these children either back home or free for adoption.
Are they at the visit? Are they part
They will be part of
like supervising or?
They'll probably be like supervisors, yes.
Okay.
Mr. McDevitt, I'm sorry, Mr. McDevitt.
Good intro from
Yeah.
just a quick question. The Warren County Children's Committee, is that a private organization? Is it-
I believe they are a private organization. They've been here before I started working here, so for probably at least 50 years or so.
So it's not a state or a federal?
No, it's not state or federal. Their main purpose is to provide benefits to the children in foster care. And they've helped us with all kinds of things like prom dresses, class rings were bigger before. They've helped us when kids have needed special equipment, maybe for sports or some other thing, an instrument maybe if they're playing music. So it lets these children engage in normal activities. And they have sent children to camp. They have scholarships for our children that go on to college. And every year we have some children that manage to graduate and go on to college. And we're very proud of those children.
Great, thank you. Sounds like a great organization.
I was going to
It
say,
is.
it sounds
They're
great.
wonderful.
Maureen, they haven't given you this lump sum of money in the past, though, have they?
Actually, it was a kind of a grant that someone gave to them to give.
Oh, okay.
Okay, is my understanding.
Okay, no, I think it's wonderful. All right?
Yes,
Mhm.
absolutely. Before we go on to Edward, last time I brought something about the fraud unit.
Right.
Today, I thought I would talk a little bit about adult services, just for a few minutes, just so you know. That's another area that we do. It's in our service department. We have one supervisor and one senior caseworker and 6 caseworkers. To be eligible for this service, you have to be over 18 years old, and you are eligible if you meet 3 criteria. An adult must have a physical illness or disability and/or a mental impairment which results in a decreased capacity for self-care and self-determination, inability to meet their essential needs or protect themselves from harm, and have no one willing to assist them, another responsible adult to help them. So these people are probably part of our most vulnerable people in our county, and our service people go out, we assess to make sure they meet these criteria, and then we assist them by connecting them to services. We're rep payees for some of the people because they can't manage their own money. 2/3 of our population in in adult protective is we're rep payees, meaning we get whatever benefits they have and we hand it out so that their rent's paid, they have their food, and we watch them. For most of those people, we need to see them weekly because we can't give them like all of their money right away, or there won't be anything after a day or two because they're vulnerable for people asking them for money or getting something that won't help them along the way. So that's what these caseworkers do. We have another area which is CASA, which is Coordinated Alternative Service Agency, works with Medicaid to help with programs for elderly like personal care, consumer-directed, private duty nursing, and care-at-home programs. And this is part of New York Connects, which is what the Office for the Aging does also. And so we try to do our best by all of these people.
That's wonderful. Maureen, about how many people do you have, adults, that are part of this program? I'm just curious.
We have 39 ongoing adults in our adult protective, and 33 active CASA people with 10 intakes.
Wow.
So we're busy upstairs with this, and they need a lot of support, the people that we work in these areas with.
I'm sure they do.
We reassess all of their needs every 6 months.
Very good question, Craig.
Wait, CASA, did you say?
Yes, it is Coordinated Alternative Systems Agency. I think the state named that.
Right. We appreciate these updates. It gives us a little better insight into what's happening in your department, so I do appreciate that. Before we move on to Edward, we forgot to vote on the one with the $15 an hour. We made the motion, seconded, but we kind of got in conversation and didn't vote on it. So, all those in favor?
Aye.
Opposed? Carried. Thank you. How are you doing, Edward?
Together here.
Is that a lot of money? Seems like. Until we get the sewer. Okay.
Morning.
Good morning.
Okay, the first item on the agenda is a request resolution for renewal of our contract with Warrensburg Laundry and Dry Cleaning for our laundry services, a 6-month period from September 1st, 2017 through February 29th, 2018, for a total annualized amount not to exceed $45,000. This figure, this $45,000, represents a blistering 40% increase over the prior year. We did send it out to bid. Unfortunately, we only received one proposal back, and that was from Warrensburg. So we are kind of between a rock and a hard place here. The money for washer and dryer equipment is in the 2017 budget, but cannot be rolled over to 2018. So if the board would like, I would be happy to pursue some quotes for a washer and a dryer, even though it would not actually be operating until 2018.
Mr. Montesi.
Just one point. Yesterday at the facilities meeting, we found out that the sewer line that is proposed is not going to be able to be built until maybe next spring. So your commitment here to February 1st, you may want to extend that beyond that, because you're not going to be able to use the septic system or the new sewer.
Okay?
So, I mean, maybe instead of 6 months, it ought to be 9 months.
All right.
And, you know, obviously, it's going to be more than 45,000, but I just so you know, we're not going to have that sewer line in.
Okay.
Ms. Bramer?
Did we determine that the septic cannot handle this?
No, Kevin maybe can speak to that.
I'm sorry, I know
Mr.
we
Gary.
go over this every meeting, I can't remember.
Yeah, I think there is concerns with the septic system handling this much of detergent and stuff, but is this a per pound quote? Was this a per pound bid, or?
Yes. It was, well, actually, I think in 2016 it was 69 cents per pound. 2017 it went up to 84 cents a pound, and this renewal rate is $1.18 a pound. And we do a little over 38,000 pounds a year, I think. So yes.
Give me those amounts again.
In 2016, I believe it was 69 cents a pound.
Okay.
And 2017 was 84, and this renewal rate for this year is $1.18.
Okay.
I believe that's a 40% increase from the 84.
And how many pounds do you do?
I think it's 38,000.
Wow.
It is.
Yeah.
Mr. McDevitt?
Just in general terms, Edward, disregarding the cost of new equipment, the washer and a dryer, what would you anticipate the cost of personnel to, let's assume you change to in-house, what would you figure? Is that a half person? Is that a...
Yeah. Yeah, I think we initially
More.
budgeted, I think maybe 25 hours per week, which would be like $13,000 per year. But we've been looking into that, and I had a discussion with our housekeepers yesterday, and the feeling seems to be is that there is a possibility, if we rearrange some things, we might be able to have our housekeepers, our cleaners, do the laundry as well as their regular housekeeping job within their 40-hour-a-week job. We have to look at it a little more carefully before we commit to something like that, so I can't say definite, but there is a possibility we might be able to do that. In that case, we wouldn't need to hire any new staff. The potential problem with that, and it's going to be a problem, is that if we have the housekeepers doing the laundry and their regular cleaning, the problem is going to be when they call in sick. We've had, as I say, quite a bit of that over the winter, and it seems to happen, everyone calls in sick all at once. And if that were to happen, that's where something like this would really fall apart. So, but we're looking at that option.
All right, Supervisor Seaver?
I was just whispering to our budget officer, asking him if you mentioned that you couldn't roll over money from one year to the next, and I said, what's going on? Did you guys talk? Did you ask him? Is there some way that we could? I did. I talked to Rob Lynch, and he
But you
said,
only can encumber it.
2017, we would need to make the purchase, at least order it, have the purchase order. A purchase order can be rolled over. But by then you've committed to buying with a particular company. That if we did not do that, the money could not roll over. So it can't be that based on the higher.
I'm gonna call Dave.
We had the money in the budget, it wasn't spent. Correct. Can't roll over, money goes back in the general fund. Correct. But we couldn't take that money from last year and put it back into this year's budget, that we're gonna spend $45,000 to go out and budget. I can put it back into this year, so that it would be 2018 funds, but in keeping, we're trying to keep costs down, when it was already in this year's budget. Next year, I've already started the budget for 2018, and Countryside is going to need a freezer, condenser for the freezer, and a couple other items that are high priced. So to get a washer and dryer and the other things that are needed, it will drive that budget up.
Supervisor Thomas?
Oh, I'm sorry.
If we get the sewer extension next year,
I'm waiting to get the letter back from planning saying that it's going to be extended next year. But I'd like to do some investigation in the septic system to see if it could handle it for a portion of time too. And then I'd like to reach out to Warrensburg Laundry and talk to them a little bit.
well, in theory, if that gets completed.
In theory, yes, it's,
Then we don't have a problem with that.
yeah, it should be completed by June, but,
Money was put into the 2017 budget purchases, so I don't know why we're not purchasing. That's the point.
Right.
well, you could purchase it now.
I did meet with the people at Warrensburg in a serious attempt to try and negotiate it down, but was unsuccessful, and the reasons they gave for such a large increase were two. Number one, they said that they had mispriced our previous contracts and we were being undercharged in prior years. And number two, they said that because of the increase in the minimum wage, they do have a lot of employees, they are very labor intensive.
Yeah.
Because of the increase in the minimum wage, they had to, jack it up. So those were the reasons they gave for such a large increase.
I believe number two.
All right, Mr. Montesi.
Well, I would say that we should buy the equipment, even if we're not going to use it until next year.
Right.
But I also think that rather than have you come back in February, if the sewer line isn't in, and ask for some more money, we probably ought to look at Warrensburg Laundry and say, what's it going to cost us to get to June? And once we get that number, then we can approve that, I presume.
The only thing I would caution there is, just say, for instance, things do come together, which they haven't come together in 2 years, but just say things do come together on the sewer line, and we get out earlier, and we have this contract until June. We need to know that we have an escape clause in any contract extension we sign, so if we were to finish, if everything worked out and we were able to get on the sewer in April or May, we wouldn't have to pay through the life of the contract or something like that. We should look into that.
We usually have a month in our contract. We usually have a clause in there so that we can notify them in
Okay.
a month that we're no longer going to
Okay.
be using it.
All right, very good.
It looks like if you divide 5 into 45,000, you're gonna end up with 9,000, so 9 times the 4 months is 36,000 additional. I mean, that's just from the numbers you've given us.
That's annual.
Yeah.
That was
The
an
40
annual.
45,000 figure is for a 12-month period.
That's for 12
Oh,
months.
12 months.
Yes.
Oh,
But they're asking,
but why is the contract only going to February?
Because we were hoping before we just learned, like everybody else.
so you could
did,
drop
that
out of it.
We were hoping that the sewer line would be finished, but it's not, so.
Okay.
So that happens in life.
Supervisor Sokol, I saw your hand up.
Thank you, Madam Chair. Part of that was just answered. I also thought this was just for 6 months, but realistically, we're probably not looking at getting that sewer in for another year or so. I mean, so here we are going to spend all this money. Why don't we just buy these machines? Ed said we could kind of look into help. We need to we need to hire a part-timer. We can probably always do that or fit it into the equation, but I think this is crazy. I mean, I understand the pay rate going up, and I do understand expenses, believe me, but it just seems like an awful lot of money to spend for the county on a couple of washers and dryers. It's just my thought. I think the committee should move forward with purchasing the equipment, and if it's a matter of having issues with the budget, we can always take money out of the contingency to purchase these items.
All right, Supervisor Leggett, and then we're gonna,
Thank you,
Move on.
Mr. Chairman. Ed, well, did we talk about doing a cost benefit, comparing the fee-for-service, the contract, and what it would take with the cost of equipment, the cost of maintenance, electricity, water, sewer, and labor, and how that comes out, and did we come up with a per-pound price of that?
Yes, I believe we might have touched upon that, but I'd have to update it. I probably should update it and make sure all the costs are in there. Like Mr. Garrity said, make sure the septic can handle it. So I'll do an updated.
Thank
That
you.
was done, Craig, when we eliminated the wash at Countryside. It was done, it was shifted to Westmount, if you remember that. Well, I remember it. And we stopped doing it at Countryside, we moved it down to Westmount because of cost factors. So that stuff's been done, but it's never been updated, but we'll get this straight.
The other option that we are looking at, and I know, as I said, we only received this one bid, is that we thought, we're trying to think outside the box here to try and deal with this. We thought maybe we'd try to approach Westmount again to see if Warren Center, to see if they might be willing to do our laundry, or maybe another nursing home, and just see what their rate might be. It might be much less than the 118.
Supervisor McDevitt, and then I think we need to move on here a little bit.
I just want to echo what Craig said, that in reasonably short order, could get us a point-by-point comparison, doing it this way, new versus old, and so that we have something in writing to look at, okay? It appears to, on the face of these numbers, to make sense to go internal, but if we could just see something in
Sure.
writing, I'd appreciate it.
Absolutely.
All right, well, we made the motion second, but we need to vote on this now. So, yes?
For extending the contract.
Right, the resolution that he was requesting to renew the contract, so we need to vote on that. So, all those in favor?
Aye.
Aye. Opposed? Carried. Now, as far as, we talked about him purchasing the equipment, are we going to wait now until he gets the information back to us?
Well, I think Frank suggested we purchase it now. Somebody suggested we buy it now, and then
Yeah.
if we can hook it up, we'll
Yeah.
get it installed.
All right, he doesn't need a motion from us, though, to do that. Okay.
It's not budget.
Okay, good. All right, Edward? Good, now we'll move forward.
Thank you.
Yes.
Thank you very much. Okay. See, the items for discussion and review, census updates. For July, we had 3 admissions and 0 discharges. In August, we had 1 admission and 1 discharge. Current census is 33. We do have 6 prospects that we're working on now, people who are going through the admission process. 5 of them are potential long-term stays, and 1 is a respite stay. So we are working our plan, and the plan is increasing the numbers. We're getting more phone calls, more tours, and more admissions, and it's just a matter of, keep going, just keep the pedal to the metal and keep it going.
Very good. I know you've been working hard at that, Edward, and we appreciate that.
Okay. The last report is the overtime page. The overtime hours we have listed through August 6th of this year. We're actually running about 100 hours more overtime this year than last year, which comes to about 3 hours more per week. The main reasons for that, number one, is we've had quite a bit of call-ins of sick time this year. And we also have one of our personal care aides who's still out on workers' comp. She's been out until February. She is on total disability. She injured her knee, and that's a big reason why we sometimes have to utilize overtime.
All right, thank you. It's been brought to my attention that we started discussion on our request without a motion and a second. So I guess we need to go back, and someone needs to make the motion to renew the contract with Warrensburg Laundry and Dry Cleaning. Mr. Montesi, seconded by Mr. McDonald. All those in favor? Aye. Opposed? Carried. I think I got up too early this morning. Okay. Edward, thank you very much.
Just one question.
Yeah.
Thank you.
How long has the employee been off on workers' comp?
Since February. It's been 6 months.
February last year?
Well, this year.
2017.
6 months.
And any projected return?
I've talked with her like every other week. She did initially go for therapy. That did not work. She went to a surgeon, and she did have surgery. That hasn't really made much of an improvement. They're going back to the surgeon, and they think they probably will need to change the therapy. They think now that scar tissue is building. There's a lot of other complications there, so it's a situation where she's really not getting better. Yeah, she's just not really getting better.
Okay.
So I don't know. There is no timeline for her return.
Thanks.
All right. Mr. Leggett, I know you had a comment.
Mr.
Yes.
Chairman, I would like to thank Edward for coming up to the Town Chester Town Board meeting. He gave a great presentation. It was a well-attended meeting and laid out all of the services that Countryside provides, and the audience was very appreciative of that. Thank you.
Thanks for having me.
No, and I know my seniors are looking forward to meeting next month with them to explain it. They're glad that you're coming.
Good, I'm
We're looking
looking
forward to that too. Supervisor Sieber.
Thank you. Just briefly, we have been so excited over the past year and a half to be members of the Chamber, and I know in the past I talked to Dee about advertising in the Chamber, the services that we have at Countryside. Has that taken place? They shared with me, they think, getting that word out the way they advertise other places. We have open beds, we obviously have, we run in a deficit. It's an important contribution to our community, but I think working with them and all the chambers would be really beneficial. Is that taking place?
That's a very good point. I did meet with them, and I did learn after speaking with them that Warren County, I believe Warren County Department of Social Service is a current member. So we were looking to kind of see if we could attend those events under that umbrella. But I don't think we can. I think we'd have to join ourselves as Countryside, which would be another expense.
Actually, Warren County as a whole is a member, so we really get our bang for our buck. As soon as we became a member as a whole, all 800 employees and departments became members, and it's one of the benefits of being a county member. So you are absolutely able to advertise with them your open bed, and that you have a service to provide in our community, and that's something that we can really utilize. Some of that is free, some of it's at a small cost as a member. But I would really encourage you to reach out and talk with the Chamber about our membership and what we have free and then what's a member cost.
Okay,
Not necessarily, the networking's great, but we ask all our employees, if they want to do that, it's on their own time and at their own cost. There's so many employees that would be attending, but we do really encourage all our department heads to use that for advertising, for volunteer recruitment, for coordination, and I wish we could do more with the networking. I don't think Frank's going to give us a budget line for that, but some of it can fall under training, and some of it though does not.
So I would be able to go to these events as a member of Warren County.
We can talk about it after,
Okay.
but I'm more interested in being able to advertise the facility through the chambers.
Okay, right, okay.
Because they're doing that with other
Right.
ones that are similar,
Right,
and
right.
we're looking to fill those empty beds, right?
Right, mhm.
And we're already
Good
paying
point.
for that service. so-
Right, okay.
Okay,
Just real quick, and I think maybe there are some events where he could use it as an advertising vehicle, but we just need to figure out what parts the county will pay for, part of our membership. Yeah, great.
all right, we have to go back to Maureen so we can finish up on your agenda. Edward, you were finished, right? Okay, so
Mhm.
Maureen?
Thank you.
Julie, okay.
Keep things short. I really don't have any concerns regarding the budget right now. Revenue's still a little low, but it's typical at the end of the year, it starts coming in a lot higher. So I'm comfortable with it for now. And our overtime, we're always trying to keep that down. We do have a couple of new caseworkers starting, which will involve a lot of training. So moving forward, it probably will increase, but for now, it's been pretty good the way.
All right. Anybody on the committee have any questions for Maureen or Julie? All right, anybody in the audience have anything they'd like to bring forward? All right, if not, then I'm going to entertain a motion to adjourn.
So moved.
McDonald, second, Mr. Montesi, all those in favor?
Aye.
Aye. Opposed, carried.